In this video, we will discuss how to perform postoperative stretches in post-frenectomy patients, specifically in infants. So I have my handy mouth model here with a frenectomy wound here. But first we'll start with general concepts. The concept that you want to think about is the wound is the area that is going to reattach. So for all of these stretches, you want to really stretch the wound to prevent reattachment. So in order to do that, you have to get either in the wound or as close to the wound as possible in order to make sure that that wound is what is being stretched. Let's discuss technique-wise. So I will instruct my patients on two different techniques for postoperative stretches. The 2-finger technique and the 1-finger technique. We'll start with the 2 and then go to the 1. For me, it's not really a preference per se, but whichever one that is going to ensure that you get the optimal stretch for your infant is the one that you want to do. But I would like for patients to know about both in case you need to do one or the other. You'll at least know how to do them technique-wise. We'll talk about how to do the stretches sequentially. So you typically will want to start with the upper lip stretch, then go to the cheek ties if those are addressed, and then go to the tongue last. With the cheek stretch, and really with all of them, the concept is you want to stick your fingers all the way into the crevice of the wound, or at the location of the wound at the crevice. So meaning for the upper lip, if this is the gum line and this is the lip that opens like this, the frenectomy wound will be along that crevice in between those two areas. So that is the area that needs to be stretched in order to fully maintain maximal range of motion. And so in order to get a good stretch, you have to stick your fingers all the way into the crevice here, essentially under the lips to where you can touch the nostrils from underneath the lip. And so you'll stick your fingers underneath that and pull on the lip all the way so it flips over on top of the nose. And so you'll see if this is the lip and this is the wound underneath, you'll see that when you flip the lip up, you'll see a diamond-ish type wound, and you want to see all of those edges of the wound separate from each other, okay? You want to be able to get that lip to flange completely over the nostrils. That's how you know that you have a good range of motion for that. You want to make sure all the wound edges are separate. Sometimes how people will inadequately do this stretch is if you put your finger into the crevice and then as you flip the lip up, you let your finger slip up the lip like this. Sometimes what will happen is that corner of the lip wound will pinch together and you can get reattachment there. So just make sure that your finger doesn't slip up the lip, but your fingers stay in the crevice here to maintain the optimal amount of separation. So that's for the lip. For all of these sites, I recommend about 5 to 10 seconds holding that position in order to make sure you have a good stretch. So for the lip, with the 2 fingers, you go as close as you can underneath the lip, and then you'll lift the lip up and leave that for 5 to 10 seconds, okay? Now you want to get as close to the wound as possible with the 2 fingers, so you make sure you're stretching the wound itself. Now for the 1-finger stretch, what you'll do is you'll again use both fingers to show yourself where the wound is, and then you'll take 1 finger and then you'll put it right on the wound and you'll bring it up all the way until you can feel the bottom part of the nose here from the lip side. And you should be able to feel it go all the way up in there. And that's how you know that you're at maximal range of motion. Okay, obviously that's your fingers directly on the wound, going directly into the crevice. So right in the crevice of the wound here. And so that can be a little bit more uncomfortable, but that is one way to know that you did a full stretch. That's also the technique that I would use to do a pop or like a deeper stretch in case that there is some reattachment that's still soft that can be re-released without having to re-laser it again. So that's for the upper lip. And then we go to the cheek ties. So in the cheek ties, so for example, if this is the gum line and this is the outside of the cheek tie was between here, you release that and it can reattach there. So what I have patients do for the cheek ties is you'll stick one finger in and you'll just run it along the upper sulcus or the upper gutter of the mouth where that tie used to be. And then where that tie used to be, you'll pull the cheek out away from the gum line. Okay. And really you just have to do that for a few seconds just to make sure that it's separated. You can also incorporate the cheek sweep where you essentially are massaging the buccinator muscle from the inside as part of that stretch as well, if you like. Okay, so you'll do that one finger, on each side if those buccal ties were addressed. And then we go to the tongue. The tongue is the most difficult part of all the stretches. And that's because it's the most uncomfortable emotionally, because you have to stick your fingers all the way, it seems, all the way into the throat for this stretch. But also because, it's the most physically uncomfortable or demanding part of the stretches. So for this, I'm going to use my little mouth puppet as well. But technique-wise, so just like for the lip and cheek or buccal tie stretches, you're going to have the baby with his or her head face towards you with his or her feet away from you, kind of like how we do in the office for the exam. So with the head closer to you, you're going to put your thumbs on the baby's forehead. That's to help stabilize the head and also to be able to help control it. And then you'll use your middle fingers to put on the chin. I usually like to have people do it on the outside here, just because you don't have to mess with the inside and have saliva be an issue. If you do it on the outside here, you can grab onto the chin and pull the chin open. Okay, so that's the key. That's one of the keys to getting a good tongue stretch, is you want to make sure that the mouth stays open physically by pushing the chin open. Okay, so don't forget that. Sometimes there's a temptation to later on in the stretch period when things are looking pretty good, you just want to stick one finger in there and do some stretches. But if you can imagine, you need to have a stretch in two directions to get the maximal range of motion. If you just stretch in one direction, for example, just sticking the finger in and pushing on the tongue, if the jaw goes with it, it's not getting that full range of motion stretch. Okay, so make sure to keep the mouth open. So middle fingers, and then that frees up your index fingers to go underneath the tongue. Okay, so that's for the 2-finger stretch. For the 1 finger, you'll put your non-dominant finger to open the chin, and then you'll use your dominant finger to go in and do the stretch. Okay, but let's start with the 2-finger stretch. So when you look at the puppet here, so we're always going to push the chin open here, okay? But I want you to focus on the wound. So the wound is a diamond-shaped wound, and it's at the crevice or the connection between the tongue and the floor of mouth. Okay, so it looks like a diamond here. You can see that if the tongue just remains down, that diamond will reconnect to itself. It'll kind of pinch down back like this, and you will get a recurrent tie. It'll be limited in mobility. So because we're opening it up like this, you want to make sure that you maintain that maximum mobility there. So to do that, you need that wound to heal in long like this. And that's why you want to do the stretches. Okay. So when you do the stretches, if you do the 2-finger technique, remember you're going to open the jaw. Okay. And then you're going to use your 2 index fingers, and the area that you're going to put it on is right along the sides of the top of the diamond closest to you. Okay. So when you put your fingers there and then you pull the tongue back, so the vector of force is you're pulling the tongue back and then pushing it towards the back of the throat. So your throat kind of goes like this, So that's kind of the direction that you're going to be pushing the tongue. Okay. Now I say push because a lot of times what people do is they think about pulling the tongue and what happens when you pull the tongue. So I'm just going to kind of flip the rest of this back here so you can see. Now, sometimes what people will do when they do the 2-finger stretch is when they put the fingers, they start out like this and then they start pulling on the tongue like this towards the outside. Well, what that does is instead of stretching the wound itself, that kind of stretches the sides of the tongue. So when you stretch the sides of the tongue like that, you can see here with my puppet, if I can get it, you can see here that when you stretch the sides of the tongue, it kind of curls like this, but then you can see at the apex where the wound is, you can see that it's bent, and that's where you're going to get some reattachment, right? So you're going to get some reattachment right there in the apex if you're just stretching the sides, okay? So in order to prevent that, instead of pulling on the tongue, you want to push in on the tongue. So it's more kind of like you're rotating your fingers inward so that you're maintaining that force on that diamond or on that top half of that diamond with your fingers together towards the back of the throat and down. So the tongue, whenever you stretch it, it'll easily go like this up, but you can see how it's still bent and it can still reattach at that crevice right there. And so you got to push that tongue back like that. And that's the most emotional and difficult part of doing the tongue stretch, is that it's got to go back. So essentially you'll see the tongue clog up the back of the throat. Now, baby's going to be okay. They won't be able to breathe through the mouth, but they're supposed to be breathing through the nose anyway. Okay. So that tongue has got to go all the way back. Okay. So it's kind of like doing your quad stretch, right? So when you pull on your quad and you pull your leg backwards and then you do that little extra push at the end, that's kind of like doing that extra push on that tongue towards the throat, okay? With the 2-finger stretch, again, make sure your fingers are together and at the top of the diamond there. And that's where you know you'll elongate that diamond straight and flat. And that's how you know you're getting that maximum range of motion, okay? Now for the 1-finger stretch, so you pull with your non-dominant hand, you pull the chin open, and then with your dominant finger, you'll go underneath the tongue, kind of wiggle underneath the tongue, and you'll either stretch it from the top part of the diamond here, okay? Or you can stretch it from just the top half of the diamond here in order to make sure that that diamond elongates fully. Okay, so where I see people go wrong with this is when they do the 1-finger stretch and they let their finger slide. Okay, now if you let your finger slide, the tongue will either flip out from under you, so you'll just lose the stretch, right? Or if you're skilled enough to just flex the tip of the tongue back, what will happen is you'll stretch the top of the tongue back, but you see that middle part of the tongue there, it's bent. So when it's bent, you know that you can get reattachment where it's bent. So don't flip just the top of the tongue back. You got to make sure that your finger stays far enough down to where you're getting on the wound, on the top half of the wound or on the tip of the diamond here, in order to make sure that diamond completely elongates and flattens out. That's how you know you're going to get a good stretch. Okay, so for the 2-finger, beware of your fingers coming apart and just stretching the sides. For the 1-finger, beware of it slipping up and you stretch just the top of the tongue instead of the crevice, which is where it's going to reattach. Okay, so those are the 2 techniques that I have my patients learn in order to make sure that they have the tools they need to get a good stretch. Now, to check for reattachment, what do you look for? Okay, so when you do the 2-finger stretch and you're putting your fingers in at the crevice of the mouth here, when you put your fingers next to where the wound is, what you're looking for is a speed bump. Okay, the speed bump signifies that there's a reattachment. Now, when you initially see the wound in like at the time of procedure, it's going to look nice and clean. but during the healing process, it's going to develop this white film, and that's going to trick you. And so when you check for reattachment, when you do the 2-finger stretch and you put your fingers in the crevice here, you'll see if there's a speed bump. Now, what that speed bump is a reattachment, right? So if you can see here, that bump, if you squeeze that bump together because it's reattached, and then what you do is you put your fingers, I'm using both fingers on the same side just because of the model, but if you put your finger on the side here and then the other finger on the other side, you'll see that there's a speed bump in the middle. If there's a speed bump in the middle and you'd have to like raise your finger to go over it, to go to the other side, that's a sign that there's a reattachment there. So when you see that, then what you'll have to do is do a deeper stretch. So for example, doing the 1-finger stretch, you're going to push right through the middle of that reattachment to open it back up. Now, you may get some bleeding there, and that's just because there's some reattachment that you have to pop. But by doing so, you're going to make sure that you have maximum range of motion, okay? So make sure that if you see it come together and there's a speed bump, that you can do the 1-finger stretch right through the middle of it and pop it back open. So instead of it healing like this, it will heal like this, and you'll have maximum range of motion. That's how I teach patients about my stretches, and that's it. Hope you enjoyed that video.